testers, welcome to today's class. Today we will look at the basics of the ADEX exam in the area of operative dentistry. Remember that the exam will last 7 hours, in which a Class 2 cavity, a Class 3 cavity and its restoration must be performed. But you must arrive earlier to perform your setup check. The tooth on which you will perform the preparation during the exam is called competent. Since this tooth is only for the exam and there is no external sale, the tooth we will practice on in the lab is the DTX, since ADEX tells us that it is the closest tooth to the competent that we can get externally. After the setup check, the first part of the examination is the radiographic analysis of the lesions that are consistent with the lesions in the competent teeth. You must write your diagnosis in your progression form, and after being authorized you can start your isolation, and the tooth cavity of your choice is your first one. After preparing your cavity to the ideal dimensions, and extending to the maximum ideal the surfaces with caries,
have to request the extra modifications using the modification request form. Do not forget to fill it properly, send it and wait for the acceptance or rejection.
After removing all present cavities and checking that you have no softened material, it is time to send your preparation to be checked by the graders. It will take some time to return your typodont. The graders will check your cavity in the same environment you worked in, measuring the surfaces according to your guide's criteria and looking for cavities.
When your typodont is returned to you, continue with the restoration of your cavity. Do not forget to remove the insulation before sending your preparation to be checked. After the revision of your restoration, you should repeat the steps with the second tooth.
Now that you know the basic process of your exam, it is time to review the progress forms that are loaded on the platform, and formulate your doubts about the process so that we can discuss them on the lab.